back. Mental illness affects millions of Americans, and some of the biggest challenges that they face are, of course, stigma and sticking to their treatments. We're taking a look at a new approach to managing right now.
1 in 4 families in this country are affected by some form of mental illness. Even though it's a common condition, there's still a stigma associated with mental health disorders.
We need to help reduce stigma, make people more comfortable talking about mental illness and seeking treatment. In the case of schizophrenia, which is a chronic and severe mental illness, it affects about 2.5 million people in the United States. In Georgia alone, it's 87,000 adults living with schizophrenia. So we want to make sure that they and their families are aware of some of the treatment options that can help them manage the illness.
When your loved one is affected by a mental illness like schizophrenia, the first step is getting an accurate diagnosis so they can get the care they need.
Jason was diagnosed with schizophrenia as a young adult. And I remember that was a very confusing time for us. It was confusing because we were trying to understand the symptoms that Jason was experiencing. And we were also trying to work with his doctors to come up with a treatment plan that would work long term. The problem was that Jason kept forgetting to take his medication. And so nothing was really working, and he would relapse because he was forgetting to take his medicine.
Medicine is a very important component. Patients should also receive other types of treatment, counseling and family therapy and so forth. But medicine, of course, has benefits and risks, and patients and families should discuss that with their provider. But when the decision has been made to use medication, we want to make sure that people will get the benefit of the drug that's been prescribed.
Forgetting to take their medicine is a very common problem that can lead to relapses. The good news is that treatments are available that can help patients overcome that issue of remembering to take their medications.
Since it's common for people with any illness to have difficulty taking medicine on a daily basis, if we can provide injections, long-acting injectable medicine, that can go a long way to helping people delay relapse and improve their outcomes. So May and I have partnered with Janssen Pharmaceuticals to try to increase awareness of the availability of long-acting injectable medicine to try to delay relapse and provide better outcomes for patients and families.
This once-a-month approach has been a big help in getting Jason back on track.
That is the medication that has worked the best. He doesn't have to worry about forgetting. He just gets his shot once a month, and it lasts for the entire month. I don't have to make that call every night to ask him if he's remembered to take his medication, because the medicine just does what it's supposed to do, and he doesn't have to worry about forgetting. And he's been very successful on this monthly injection.
The National Council for Behavioral Health is a resource the public can use to learn more about mental illness and this latest approach in treating patients with schizophrenia. That website is nationalcouncil.org/LAMS.
That is some very good info. And on average, adults living with schizophrenia have 9 relapses in less than 6 years, even though research points to the benefits of long-acting medicines to help prevent relapses. They are currently underutilized. Stay right there. We'll be back with Signature Mike.